Welcome to the second webinar of this project here, Collaboration Building, Establishing a Firm Foundation for a Relationship. Well, you have been working with us for about 9 months now, and so you know that we're Rural Health Innovations, and we're continuing to work across the country to connect rural healthcare organizations like yours with innovations that enhance the health of your rural communities. The Idaho Path to Value project is sponsored by the Idaho Bureau of Rural Health and Primary Care, a part of the Idaho Department of Health and Welfare, a division of public health. With our time together today, when we're done, I want us to understand the foundational steps in building a collaboration, be able to select various engagement strategies to build trust and relationships with potential community partners. But also today, when I talk about community, in some instances, it simply is someone from another part of your health system that you're normally not interfacing with, and they bringing them into a collaboration or a partnership. It's the same kind of techniques that you use for them as well as community partners. And at the end, have tools to develop a plan for bringing these partners to the table. As you've been developing your strategies and figuring out how to implement those strategies and working on your work plans, you know who you need to pull into your team to make your project a success. Some of you may have partners from outside your organization, sometimes maybe many and sometimes fewer. But again, these strategies work with community partners reaching outside of your walls, as well as reaching into other parts of your health system. The December webinar for the Maple Group was about expanding your Path to Value project team beyond your walls. When we send the recording and associated materials for this webinar, we will include the link to that webinar as well. It'll give you ideas and tools of how to determine further partners that you should be pulling into your work groups and into your collaboration or project. If you already haven't listened to that webinar, I do encourage you to do so. Today, we want to focus on engaging those partners, those team members, when you bring them on board, as you begin to develop a relationship and build trust with them. You personally, your organization, and other organizations are making an investment in this project. It's a project that will make a difference for the people in your community. So you don't want to lose any forward momentum. And keeping the momentum going may seem like an odd thing to talk about at an earlier stage of developing partners or developing this working group. But this gives you a very rare opportunity to be intentional about keeping forward movement with your group. I'd like to offer a few key ideas in keeping momentum moving forward in partnerships and work groups, teams, while you build relationships and trust. The first two ideas I'm going to offer, I just say, come from Deb's book of experience with the years that I've had working with community, working with teams within organizations and so forth. And the first one it's key, and so often I hear people say, well, I have to build buy-in. Well, you've spent a great deal of time being intentional about who should be involved in this work group and in this project. Engaging the right people at the beginning and at the very beginning is so important, because that's what leads to ownership. You want partners to feel ownership. You don't want to be forced to have to create buy-in. because you see, buy-in is asking for someone to embrace an idea that you didn't involve from the very beginning of that discussion, where ownership is what people feel around an idea because you involve them at the very beginning of that process. And it's the difference between having somebody walk alongside of you and having to push a boulder up a hill, is how I often say it. When people have ownership, they come in at the very beginning, and it's where collectively they figure out how to achieve outcomes from the very beginning, because they were brought in to create a future. And this is what you did in the 2 workshops that we had in the previous months here. You brought some new people in. So you were bringing them in at the square one with your planning. And so they were involved. So you shouldn't have to create buy-in, because they should have ownership. The second thing that I found through the years is when it comes to responsibility, give people real responsibility, responsibility that they can take ownership for. By giving responsibility, you're able to get it off of your to-do list, which relieves stress on you. But the one thing that I have learned is that you also need to be willing to realize that there's more than one right way to do something. So when you give up responsibility, you are taking that risk that it might not be done the way you would be doing it, but you're giving up that responsibility in order to create forward momentum. So from Deb's book of experience, involving others and giving others real responsibility makes a person feel valued, and it's really a key to continued engagement. In line with the first 2 is to identify and form subcommittees to get work done and bring that work back to the larger group. Keep in mind that you can expand your group because of creating these subgroups. Now, part of that last workshop, the action planning workshop, was creating those subgroups. And many of you brought people in from other departments within your healthcare organization, as well as the community. So you were expanding your project team in that sense. And by pulling in other people and creating subgroups with real responsibility, you're really creating that ownership and that forward momentum. Celebrating and sharing accomplishments often, whether they be big or small, within that group, just the group together, we did this, to sharing it across organizations, sharing it with senior leaders of organizations, that persons from outside your healthcare organization, sharing it with their leaders, the success that happened. And sometimes it's very appropriate to be sharing it at the community level as well. Taking time to build community will build relationships, and it's that foundation block, that base for building trust. It also creates forward momentum and will take and develop or drive higher performance. Successful project teams strive to build a sense of community and establish trust and respect amongst themselves. Trust is fragile, yet without trust, the likelihood of that team being unproductive and falling apart is really pretty high. Simply put, success is attained through building a collective working relationship. A way that our organization builds relationships is to start meetings off with a short check-in where we share one good thing that's been happening in our life, acknowledgments for jobs well done for others on the team, something that we're grateful for, sometimes even how are we showing up today? Are we showing up joyful? Are we showing up kind of blah? Are we showing up stressed? How are we showing up? And that goes for building relationships as well as understanding how we're working together that day in the committee. Knowing what completion or success looks like really is a beacon to aim for. Setting measures and goals or outcomes lets the group see progress, and seeing progress simply creates that forward momentum. Identify meeting expectations and a schedule early on so team members know what to expect, and develop a standing agenda if possible, and always schedule the next meeting at the end of the meeting that you are in. Asking everybody to bring calendars to the meeting, and this all will become simply part of the culture of your work group, of your team. Another consideration is to have different members of your team take turns to be responsible for different things, like taking notes, hosting the meeting. It all just begins to create accountability, which increased accountability leads to increased engagement and forward movement. If you're meeting virtually, because I know many of us have chosen to continue meeting virtually for certain meetings versus going back to in-person because it just works better, creates more time for us sometimes, decreases drive time and so forth. Really, we encourage people to have their cameras on so everybody is truly present. The projects that you're embarking on is not just a simple one and done. It's a longer term project for you to actually see what's the goals that you are trying to take and achieve, and to see the outcomes. So when a longer term project, there's a lot of space to try new things. Think where people can have freedom to decide on what technology they might be using, practices and methods that they might like to adopt. Make it a great learning experience, and not just we're simply doing another project, something that people can be excited about because they're trying new things. And I also encourage you to move people out of their comfort zones. Usually people end up taking responsibilities for tasks that they're very familiar with. Encourage people to work in areas that they're not as familiar with, because sometimes having a challenge and learning something new really motivates people to keep being involved and keep going. So when you're building teams and putting work groups together, taking responsibility, keep that in mind. Encouraging an IT person, for example, to work on community engagement strategies. That's out of the box. It's not something they do on a day-to-day basis, but it is something that technology can play a huge role in, but also it's a new way of thinking, and it just builds that forward momentum. Continuous planning and intentional planning goes a long way to sustaining a partnership. Taking time to listen and work with all of the partners initially to decide where this partnership wants to be in 5 years from now, and some of the ideas of how to get there. And again, this is the process. You did intentional planning. And I really encourage you to take and look annually at the strategies that you have for your project, what needs to be changed. And you know, with how often our healthcare environment is changing and other aspects of our world is changing, we really need to do some kind of continuous planning every 3 years, 5 at the very most. So being intentional about that. And remember that I talked about giving responsibility. Having people involved in this intentional planning is a way to give them responsibility. Your overall strategies are accomplished by a series of smaller initiatives, and these are perfect things for subsets to be working on, making the planning and implementing it. And all of this leads truly to feeling valued as a member of a group. There you go, 12 ideas to keep momentum moving forward for your current project and other projects that you're involved in your life. So we've talked about how to engage people. Now let's shift our thinking to who to engage. We have a worksheet that you can use to list your potential partners. We talk about this in detail in the webinar that I mentioned from December for the Maple tier. So I do encourage you to listen to that recording to better understand how to determine who to be reaching out to, who to bring into your team as time goes on. This worksheet gives you the opportunity to list those organizations that you should be involving, or a specific person who might represent that organization, their role in the partnership, along with what the partnership can do for them. And then there's a space for you to write a message to engage that partner, and also who on your team is responsible for delivering this message. This worksheet will be attached to the recording of today's webinar. We've learned about engagement strategies, talked really briefly about who to take and engage. Next, I'd like to introduce you to a tool that will help you figure out how to work together over a longer period of time. We all like to know what we're getting into before we get involved in something and how that group might be functioning. So formally deciding how you are going to work together is one of the key foundational pieces. For lack of anything else to call it, I just call it working understanding. We do this so we have formally outlined its purpose, its scope of work, how we're going to work together, setting up accountability, developing milestones, and identifying some possible risks. We do this so those that we're inviting to be partners with us and work with us on these projects know essentially really what they're getting into. It encompasses internal elements unique to your organization and external elements more unique to the community that you're reaching out into. Something formally needs to be written down, and here's a template that can be modified for your situation. And perhaps sometimes it needs to be modified for each potential partner that you ask. But the potential elements that you might like to consider including would be purpose and background. You're encouraged to develop a 2 or 3 sentence description that contains such elements as why the partnership is being formed, some of the background behind the partnership and why it is there, and a connection to your organization and their organization's mission and vision, and really trying to stay at that big picture level. Then there's the partnership's mission and objectives. What are the desired outcomes? What are the successes? What is the definition of being done? Milestones. What are some of those key milestones, key deadlines, steps or sub-steps, steps to get to that big picture, that purpose, or that you identified previously? Roles and responsibilities, structure the roles, how your group is going to be structured. Is there a subgroup that meets on a regular basis and then pulling in the full team every other time or something like that? And who's responsible for what activities or what deliverables and what authority is there? Some of your Projects, there's one or two of you that may have authority within your healthcare organization for that specific project. And sometimes it's just a matter of finding a champion within your organization to have that authority. You're all at a little different place with your projects. Exclusions is another area to be considering. And this is more important than we often think. You need to decide what you're not doing. So often when a work group forms, and you can't think of a name of any of your current work groups right now, but if it's a group that's going to address care coordination workflows, but you're doing it around your intended population. So someone within your healthcare organization that works with a totally different intended population might say, well, this work group's doing workflows, so they're going to do my workflow too. So it's really important to know what you are and are not doing. Consider related or unrelated things that others really might assume that you will be taking on because of this particular project. So know what you are and are not doing. And you have that document to be able to say, this is what you're up to. And then finally, resources. What kind of budget do you have? What kind of time does your staff have? What kind of time partners have? What technology do you need? And what other kinds of supplies might you need? This tool will be included with the recording, and use the parts of it that seem to make sense to you and would be helpful in your project. I'd like to conclude our time together with some real life examples. We work with several other programs here at the center. The Delta Region Authority and Health and Human Services Administration, we're familiar with that Federal Office of Rural Health Policy, support a program called the Delta Regional Health Systems Development Program. And here internally, we call it Delta for short. So, because it's kind of a mouthful to say that, even if we use DRCHSD, I have a hard time remembering that all the time. But one of the aspects of the Delta program is very similar to the work that you're doing, except they're doing some of the work you're doing in 1 year over 3 years. The community champion or team lead and their hospital leadership participate in this 3-year planning process. It's designed to establish a comprehensive foundation to enhance care coordination efforts by really leveraging community partners. It's an approach that guides planning, developing, and implementing and sustaining collaborations over time between the hospital or clinic and its community joint partners. The approach is designed to build and strengthen the community's capacity and create partnerships that establish long-term collaboration and plan for sustainability. All of the healthcare organizations participating in this program are on one side or the other of the Mississippi River, south of St. Louis. And it includes PPS hospitals, critical access hospitals, clinics, rural health clinics, and FQHCs. And there's currently 32 hospitals participating in this program. I've had the opportunity to work with many of these community champions or team leads in the last 2 years here. One of my coworkers and I interviewed 3 of them about the collaborations that they have been building in their communities. And I'd like to share a few of their tips about collaboration building. As we listen, you're going to hear comments on the importance of knowing the history of collaboration in your community. You're going to hear some ideas on starting partnerships, some things on how to build trust, and then some challenges to be aware of. And I'm going to have to stop sharing my screen because I did not say sharing screen with audio when I did it. Share sound. There we go.
Looking back through the history of what we've done in the past, even before my position here as community champion, the community tends to just gather key players for whatever topic is at hand, and that's going to vary greatly, and could be pastors, law enforcement, parks and rec, to the Chamber of Commerce. And once they've gathered those key players, they sit down and make a plan and put a timeline to that with responsibilities and members on different committees.
Talking to everyone and listening to everyone. And while we're listening is making sure that we're getting those right people to the table. You know, Deborah talked about your partner list that you've been working on. And I cannot stress enough how much I thought that was kind of a silly tactic and tool and task that we had to do. However, it really forced me to think outside of the box in terms of who those players and right people were. And we've had amazing luck with people like the Farm Bureau and U of I extension programs. And those are people I probably wouldn't even have thought about talking to had we not done all of those steps of doing that partner exercise. So getting those right people there and listening to everything that they had to say. One more step, I feel like I'm just copying everything Deborah said, but the subcommittees, because the action teams that we in 2 years have seen the most movement on are the teams that have those good active working subcommittees. And like Mary just said, that are following through and are moving things along. And so you see the most progress with the committees, the action teams that have had subcommittees, in my opinion.
I think for us, we first had to gather our facts and statistics and look at the community health status report. Then we gathered those partners to discuss a plan based on those facts. And what was very important, I think, in some of our success is we created a dashboard that listed all of our goals and plans for each group or person, and we updated that as progress was made. That dashboard would have the goal or plan on one side and would even have a specific person's name attached to that specific goal for accountability purposes. And like Jennifer said, communication, stay in touch with the team members, help them keep finding their why. And also when you're planning those goals, you need to find a way to connect with the audience, something that will resonate with them.
For me, what was really important was to grow the working relationship with some of the partners that I had not been familiar with before. And again, I cannot stress enough how important it is to follow through. If you say you're going to send an email or contact a committee or individual, follow through and make sure that you stay in touch with them. Communication. I know I keep saying that, but it really is. And to listen to what their wants or needs or input. I think listening. I'm complete.
And as Mary said, is being able to have, communication, listening to them, but finding some ways to help them create some quick wins in some of these groups. So then I'm going to use the word buy-in, Deborah, but then they have buy-in with the whole process of what we're trying to do, and they have that ownership over the whole thing. Is if we could hurry up and try to find some quick wins that they see that this is going to work.
I think it takes someone meeting people where they are, whether that's your residents as well as your community partners. So I did a lot of boots on the ground work, went directly to them and was personable and transparent in what we were trying to do. And like I said before, we just try to help them find their why, and why they should partner, and how they would benefit from the partnership, as well as how our residents would benefit as a whole in and to improve population health. Um, and I can't stress enough, I know it keeps being said, but communication, that seems to be key in keeping people involved and connected.
Okay, well, two things. One, and this has been a hard thing for me internally, personally, is to remember that I and the hospital do not have to be a driver of all the activities. So that's been a challenge for me, because I tend to take over situations a lot. And so it's been a challenge for me personally to let go and let others have that buy-in and that ownership. And honestly, been very pleasantly, I hate to say surprised, but that's just who I am. But it's worked out really well. But one of the big things that we have struggled with is, with one of my action teams in particular, is conflicting and competing grants. And that has been one challenging, and it has definitely delayed our progress. And even still, after having a big facilitation summit, I'm going to call it that, we are still delayed in getting on track with where we want to go with everything. So competing grants that are all trying to do the same thing, that's been challenging. Everyone was getting confused as to what we were working on, when we were working on it, and what committee was meeting, and who was doing what, and what their goals were. And we were just confusing a lot of different action plans and steps, and work wasn't getting done because of that.
I think for me, the biggest challenge was busy schedules of people. I mean, there's an old saying that says, if you want something done, ask a busy person to do it. Because the movers and shakers are people who get things done, but they're extremely busy and their time is valuable. So I had to try to kind of modify meetings as best I could. Sometimes we could meet in person, other times not. Zoom has been a great asset, even not taking COVID into consideration, to save people time. But one of the things that we did that was helpful to tackle that challenge was we would sometimes have what we called our update email chains, and it would have all of the committee members, sometimes just one committee, or sometimes the whole collaborative as a whole. And we would kind of give updates, and we would stress to hit reply all so everyone could see what was going on. And then after that chain ended, I would send one email with a summary of all of the updates for each committee. And that way people could participate as their schedules allowed and their time allowed. And it's not as ideal to be face to face with someone or in a Zoom, but it worked.
For me personally, we had a change of leadership, and I think trying to redirect or find our way has been a little bit different. I'm not saying it's a bad thing. I'm just saying that we're still trying to figure out which direction we're headed, and everybody be on the same page. So that's been a little bit of a challenge, but not too bad. And then, just the busy schedules, trying to make sure that everybody can come together at a certain time or certain day. And I think that has been probably the most on our computer issue that we had when all the computers were down for 6 weeks. That was kind of big. But other than that, I think it's been good.
So more minutes is what we send out after every meeting, and they are sent out in a timely fashion.
I think just what I said before about if they were unable to attend, that we would try the email chain. And then the important part of that was at the end, I would send a summary, because that can get kind of confusing when you're getting all these emails coming in. But it does allow people to participate as they see the items coming in, like a conversation. But the important part was my email summary is like Jennifer's minutes. I would just take all of that information from that chain and summarize it into this is what's been done in this group, and this is what's been accomplished, and this is what still needs to be done.
Again, I'm going to say the University Extension Office. I've done so much work with Estrella is her name, through the Extension Office. She has arms that reach in every direction and has been, she's just been great to work with. I love doing projects with her. We're digging deep right now into a fresh food. Hopefully we can get a grant and get this out, and we want to do that wholesome food script for our community. And she is so excited to take this on with me. So it would have to be her.
Okay, most valuable, I think, is an local organization called Tomorrow's Hope. It originally started as just a pregnancy center, but now over the years they've expanded and they have connections to so many different demographics and offer so many services. They're involved in the court system. They are involved in food pantry efforts. They offer counseling services and just so many different things. And also one of their employees was one of the people that was featured on our video and told her story. And so since she is involved in so many things in the community, people are really surprised to see a face that they know so well and is so involved, say how she struggles and no one knew. So she was very valuable, and that whole organization was very valuable. Our most creative partner, probably Crow Media. I wouldn't have thought about a media partner being an asset like they have been, but they were the ones that helped us put our video series together and gave us ideas of ways to intertwine those that we would not have thought of before, and ideas on photographs to feature and footage to have, and they were just super creative in how they wanted to push out the video series.
Well, I hope that hearing from peers, although in a different part of our country, I think there's some things that can really relate to the work that you are currently doing and are going to be embarking upon. When I selected the clips, I was thinking about things that you might be running into in the next year as you progress and go forward. So we set out to understand the foundational steps in building a collaboration, getting a group working together and keeping that forward momentum going. So remember the 12 tips for engaging partners, and don't forget the elements of the working understanding, and that potential partners worksheet will help you make sure that you're on the right track. Knowing engagement strategies that build trust and build relationships. Again, referring to those 12 steps or 12 tips of engaging partners and the hints from your peers in the Delta region. And to develop a plan, using the working understanding tool is key in developing a plan along with that potential partners worksheet. And both of these, again, will be attached to the recording of our time together here today. Well, I thank you for your time this morning. And if you have any questions as you're starting to reach toward more partners, whether they be from your healthcare organization or be from your community, feel free to connect with any of us here on our team, and we'd be glad to help in any way that we can.